Thank you, sir.
All right,
Appreciate
now.
it. Thank you all.
Sabrina Shrader. Ms. Shrader is the Vice President of West Virginia Healthy Kids and Families and is an advocate for individuals struggling to get out of poverty. She advocates for increased mental health services and programs like Parents as Teachers and in-home family education, Birth to 3, Early Head Start, and Head Start. According to Ms. Shrader, these resources are effective, but not all of them exist in many of the hard-hit communities in states like West Virginia. Welcome, Ms. Shrader.
Okay, thank you. Thank you, Chairman Cummings and committee members. I'm grateful to be included, and I actually prayed for you all to make it back, and here you are. My name is Sabrina Shrader, and I grew up in Swim Branch Holler in McDowell County, West Virginia, one of the poorest counties and one of the poorest states of the country. My family and I were born into generational poverty. I know what it's like to not have enough food, to stand in line at a food bank and get food stamps, to not have enough money to pay the electric bill, to not have health insurance, to walk miles in the snow because my car was broken down, what it's like to be the only one who graduated from high school and obtained a bachelor's degree in a family. It's not something that I have ever felt proud of. Poverty is not families' or children's fault, but the policies in our country and the way we treat low-income families as a society says differently. Living in poverty is a continual punishment. Water is not clean, food is unhealthy, and homes are not safe. I wholeheartedly agree with Senator Sanders, who says it's wrong that in such a rich country, we have one of the highest childhood poverty rates. Education and a living wage. That struggle continues for me to this day. Even though programs and people helped me to get this far, I still have more than $30,000 in college loans to pay, and it has been 8 years since I earned my bachelor's degree, and my bank account is seriously empty. The Democratic platform should include Bernie's plan to make tuition free at public colleges and universities. Other countries do this, and so should we. Please include a priority in the platform to lower student loan interest rates. The rates make it harder for millions of Americans and me to pay off school loans. Support for childhood development programs like Head Start and Birth to 3 help children at an early age. Additionally, programs like Gear Up, Upward Bound, and Student Support Services are crucial to save lives. Many who grow up in poverty, the idea of going $50,000 or more into debt is unacceptable and terrifying. So instead of pursuing higher education, they take jobs at Walmart or McDonald's, continuing the vicious cycle of poverty. No one who works full-time should live in poverty. We need to raise the minimum wage to a $15 an hour living wage, and we need to raise salaries for people like teachers. I'm a substitute teacher, and if I worked all year, I wouldn't even bring home $20,000. I'm 32 years old, and I don't have kids yet, because I don't want my kids to suffer like I have. When state funding is cut, educational programs are the first to be slashed. It's inhumane that many families don't have access to education and employee protections in America. Infrastructure. Another reason for the continuation of poverty in rural Appalachian communities and other impoverished areas, there are either no roads or the existing roads are in poor conditions and they fail to connect us. Improving and building new roads will give access to resources, hospitals, colleges, and each other while creating jobs. I encourage the drafting committee to include a strong commitment to rebuilding roads, bridges, and railways while increasing access to high-speed internet and basic services like drinkable water. Today in America, many families I know do not have internet access or phones because the services are unreliable and expensive. Senator Sanders' Rebuild America Act would invest $1 trillion over the next 5 years modernizing our physical infrastructure and would create 13 million good-paying jobs for Americans. Passing this legislation is enormously important to West Virginians and all Americans. Health and addiction. Because of the roads being dangerous and people needing immediate medical help, people die on the way to the hospital. I've had several family members die, and when you're born into generational poverty, all your family is dying before you're born or while you're born. My mother's 2 favorite aunts, one died 2 days after I was born. I was born 3 months early, so she never got to see the picture of me. My mother found her dead, and the other aunt died 2 months later. Poverty leads to toxic stress, so we need more healthcare providers to combat mental illness, addiction, and preventable health issues in every county of West Virginia and around the country. We need a Medicare for all single-payer healthcare system. I have more than $15,000 in medical bills from years ago that I struggle to make payments on. Community reinvestment. The poorest communities need help the most, while they have the hardest time getting the resources necessary. There are few charitable and nonprofit organizations in Mercer and McDowell counties. The ones we have are underfunded, and we don't have money for grant writers. West Virginians are working together, and we implore you to consider a strong commitment in the platform to rural community revitalization, including trade apprenticeships, after-school programs, and mental health and addiction treatment centers and services. It is my calling to be a political leader. The voices of those who have experienced poverty firsthand must be heard and included in our country's government and in our policies. I am running for a House of Delegates seat. I'm doing everything in my power to combat poverty in West Virginia. God has blessed me to make it through many obstacles, and every day I am stronger, but I need help. We all do.
Ms. Shrader, thank you for your testimony. I've often said, out of our pain often comes our passion to do our purpose. And listening to your testimony, I'm convinced that you are taking what you've gone through to help other people, and we really appreciate it. Ms. Ten.
Thank you. I really want to honor your comments, and I'm really grateful that you're here. I wanted to ask about an issue that you didn't touch on, but is in my view, a big driver of challenges for low-income people in America, which is childcare. Childcare is a dramatic cost for families. It's a rising cost. It eats up more and more families' income. You referenced education costs, after-school costs. Rural communities are really disproportionately affected by lack of access to quality childcare. Mm-hmm. I'd love if you could share your views on this real challenge for so many working families and people who are struggling to find work.
Well, you're right, and thank you for the question. In America, the reason we have child care is so we can go to work. Well, the problem is all these people who live in West Virginia, the majority of them can't afford child care. But if they pay for it, it's like taking more than half of their paychecks. My solution to that is for employers to provide child care. I mean, if we really care about families as a country, we shouldn't have to worry about not having paid sick leave. No, like if your child's sick and you can't take them to the doctor because you're afraid of losing your job, what happens? Your child gets sicker. Or a family member. If a family member gets sicker, my stepsister died a few years ago from pneumonia. She was just like a year older than me. And I've heard some of you talk about a lack of heat. Well, my dad and her stepmom had heat, but it's so expensive. The electric companies have a monopoly on our state. One electric company runs the northern part, and another company runs the southern part. So not even with just childcare, electricity is so expensive. There are a lot of issues. But like I said, if we reinvest in the communities, we can create jobs for people. There's lots of people, like we could get a grant-funded child care center, community center. Like don't just use one solution to a problem for one thing. The schools could be opened in the evenings. I mean, there's all kinds of things that we could work on to make things better and easier. But we have to bring people like me and people who are struggling through these problems to the table and let their voices be heard, because for so long our voices haven't been heard.
Yes, Ms. Marker.
Yes, hi. My daughter just sent me a text. First Nations Club from Everett Community College says they're huge fans, and they appreciate the work we're doing, but they also said they can relate to you, the speaker, with poverty, childcare, the cost of education, and I guess my question would be, in the K through 12 arena, how can we help children in poverty? We know there's a homelessness number there. What can we do to improve the K through 12 system for these families that are struggling?
Thank you, and I just wanted to let you know my dad is my grandparents are part Apache. Yes, I'm glad you asked me a question. For one thing, I did not see a book in school until the 4th grade. The only book I had was the Bible, and I didn't know the King James Version was just another form of the English language. So I really didn't understand it. I didn't believe in myself until a few years ago. So now I understand it and I can interpret it, but I spent my whole life trying to figure that out. When we talk about the King James Version language, we can apply that to the political language, the lawyer language that's used in our policies that makes it almost impossible for people like me to understand. I've spent 3 years going to every policy workshop, every conference I could. Like, I don't have a salary. I use the little bit extra that my husband has to do everything that I'm doing. Some schools, I guess, can't, their funding gets cut. We've lost a lot of teachers in Mercer and McDowell County because, like I said, with education, with our political system, the first thing that they cut is programs that help children and families, and education is a program, and the first place that gets cut is the southern part of the state, not the northern part. I just went to WVU. I went to a conference last week, and I went to WVU after that. But WVU is the northern part of the state, and they have all these programs and all these things that we have never even seen, and we're not being included. And I'm not picking on WVU. I'm saying the bottom part of the state, you need to start from the bottom up. And we're willing to learn. We're not resistant to learning, like the research says. We're not at risk. We're loving people who love to learn, and we're all working to make our communities better. I'll tell you one issue that you could really work on. There's someone the 5 Loaves and 2 Fishes food bank in McDowell County fed half the county last year. One of the people there is Joel McKinney. He is hydroponically growing food outside on the side of the road at the food bank in McDowell County. He can't apply for these certain grants because they say you have to grow the food in a traditional way, and hydroponic is non-traditional. He's also a veteran. So we really, if we can talk to you more, there's all kinds of ways to fix this stuff, and I'm really grateful to be here. Any other questions?
Congresswoman Lee?
Thank you very much.
Thank you. God bless you all.
Glad we made it back to hear your testimony.
Thank you.
So much. Very powerful and very, very clear. Let me ask you a couple of things. Just
I thought it was my time
one.
to go.
She just wants to ask you a few questions.
Okay, that's great. That's wonderful. I thought you were making me leave. Okay.
No, just a couple. In terms of the Affordable Care Act and health care, you mentioned Medicare for all. And of course, for me personally, that makes a lot of sense. In West Virginia, could you kind of give us what it looks like? What's the picture? You mentioned people dying en route to healthcare facilities. Give us a sense of what's taking place in terms of coverage. And then secondly, and this is just a more general statement, oftentimes, like now we see huge budget cuts as it relates to food stamps, all of Head Start, all of the initiatives and programs that have worked to lift people out of poverty. Well, the Republicans, with their new poverty initiative, they want to cut all of these initiatives. Oftentimes people turn against each other because they don't understand, who the real culprit is. How do you, and how do people in West Virginia perceive these budget cuts that are taking place and efforts to not lift them out of poverty, but to really dig a deeper hole for them to fall into, recognize, and we know what's taking place, but do people on the ground who are surviving and trying to just make it from day to day understand the dynamics there?
They understand the dynamics. One of the problems is they don't understand the language that's being used. For example, like right to work. That's cutting workers' rights. So they're saying right to work. Yeah, we want to work. We're hard workers. They don't know that's decreasing your protections. With the budget cuts, I don't know if you all know this right now. Right now, we don't even have a balanced budget in West Virginia, and the Republicans are in control right now. And there's a lot of people who don't understand how this all works, and how the government works and which side is for what. The Democrats are for loving people. People think that Republicans are Christian, and there may be a lot of Christian Republicans, but I have yet to seen one that I believe, that's in the government, that I believe would do the right things for those living in poverty, because I don't know not one who has lived in poverty. With the healthcare situation, Welch Emergency Hospital is a state hospital in McDowell County. Half their hospital is getting ready to shut down. They have no trauma center. When Ms. Manchin said that McDowell County was isolated, well, it's not that we're isolated, we're just left out. The roads aren't built for us, the interstate, we have no interstate, and we're separated by mountains. People end up dying on the way to the hospital in a vehicle, in a helicopter, because the closest hospital that can service them is hours away. With the healthcare system as it is now, the expanded Medicaid did help over 100,000 more people in West Virginia. However, if you don't have even decent services, you go to a doctor and they misdiagnose you or prescribe you the wrong kind of pills, and you have an adverse reaction, like I have several times before, and it almost killed me, you don't trust doctors anymore. And so you find natural ways to heal yourself. So there's that, or there's also people who have learned that when you go to a doctor, they've learned what you do is you go to a doctor because you're sick, and then the doctors prescribe you pills. So then you think the pills are going to make you better, so you take the pills. I was taking narcotic prescriptions for about 10 years, and I never did anything, wrong or bad. I wasn't mean to people, but it made me not love myself. I quit taking those pills a few years ago, and I've been healed from that. But I see what people who are addicted to drugs, I have went through what they've gone through, and it is very difficult. We don't have the services to help people, and I've been a crisis counselor. People are, when they're detoxing, it can kill you. You can die. If you're an alcoholic and you just stop drinking alcohol, you can go into a coma and die. That happens. So we have a high demand for increased healthcare access and better quality. Does that answer your questions?
Your testimony has been very helpful. Thank you very much. We really appreciate you.
Thank you.
Keep fighting.
I will.